Good afternoon. We continue to focus our efforts on the national emergency going on in our senior residences. We are getting more staff in the residences. We're going through a tough situation, but we're doing everything we can to take care of our elderly. We're in problem-solving mode, and we'll get through this together. Thank you all.
Good afternoon, all of you. Premier Legault, it took you a while before asking your specific needs to Prime Minister Justin Trudeau for the Army, like to express that you needed the Army to come and down, like. And now, what are your expectations with the members' forces, the 125? What do you expect them to do? And regarding the tragedies in CHSLDs, maybe your call should have been made like earlier.
No, we're asking Justin Trudeau since few days if he's got some members of the forces having qualification, health. In health, especially nurses. We only got the final answer this morning that there are 125 people that are available to do that. So as soon as we got this information, we confirmed that we want them. So no, we were asking since few days how many do they have, and we didn't get the answer until this morning.
Question?
A colleague of mine did a story about families of loved ones who died in CHSLDs, and it took a while. I think after a week, the person died. They are still waiting to see where the body is. How is this possible? First of all, for you, Mrs. McCann, and then second of all, is this type of situation, Premier Legault, that pushed you to have this reflection about tragedies in CHSLDs and what you could have done as a Premier to avoid these tragedies?
Well, we have to give very special attention to the families. And we will look into what you're saying. I think what we have stressed from the beginning is the importance of communication with the families, and especially to know where their loved ones are. So we will look into that, but we want that the families be informed day to day, and we've put people in the establishments to communicate with the families. And I will even add that we need to provide support, moral support, to the families who are going through what they're going through. So we will organize that. We have planned for this, and we will provide support. But I will look into the situation you're talking about and talk to all the organizations to really make sure this information is provided very quickly.
Thank you. Samuel Pouliot, CTV News.
Hi. We're being told that some healthcare workers are testing positive for COVID-19, and they're still being told to go back to work because they are needed. If someone is positive or waiting for results, should they be working? And for those who were in contact with infected people, infected colleagues, can they be retested and go back to work before the 14 days quarantine is complete?
Well, I'm sure Dr. Arruda will want to provide you information on this, but our directive, our orientation is clear that people have to be asymptomatic to go back to work. Let's say after 7 days, and they are asymptomatic, all the protection has to be taken. These are very exceptional circumstances. This is not for everybody. Very exceptional circumstances, and they have to take all the protective equipment, take all the measures, the temperature twice a day, and I think that if we get all the additional people to help us, we won't have this situation anymore. there are certain areas, certain CHSLD, where we need to provide more staff right away. And that's what we're doing right now. And these are the CHSLD that are more at risk for a shortage of staff. So we want to settle that, resolve that, so we don't have even to make that special provision. Other than that, it's we are following the directive of the public health.
Second question.
Can you respond on the reports that many deaths that happened at the CHSLD Aaron came after the residence was taken over by the sociaux, and that administration of that CHSLD continues to be a problem today?
Well, what I have as information is that the situation is under control right now. The sociaux has provided a lot of staff, is organizing all the work. We have sent also, I've also written a written request for a special inspector, Mr. Sylvain Gagnon, who is a very experienced manager and even has been a deputy minister, who will review all the situation. We know also that there are three investigations, so we will wait for the results of those enquêtes and, of course, take all the measures that we need to take.
Our next question goes a little bit in the same way from Phil Autier, Montreal Gazette. There's a discrepancy between the timeline on what you say happened at the residence Héron in Dorval and what the sociaux West de l'Île says. The Gazette has examined the official death registry with names and dates, and it seems those deaths happened when the sociaux was in control. Why is the sociaux hiding the true story?
Well, again, I'm stressing that there are three investigations going on, and there's a next deputy minister, an accompagnateur, an inspector that I have sent, and will give me a report in a few weeks. And we want to shed all the light on this. What I'm saying at this point is that the sociaux took over and is providing the best care possible to all the people in the residence. And we have to remember also that they didn't have access to the files for a few days, and finally they had access to the files. So what happened exactly? I think it's better, it's really more wiser to wait for the investigation and the results of the investigations and the inspector that I have sent. But I want to say that the sociaux is doing everything it can to provide good care to the people who are there right now.
The second question is also for you, Minister McCann. Last week, you announced that all residents and workers in the CHSLD networks will be tested for COVID-19. Now we see there's a ministerial directive to not do that. Why is that? Is this not dangerous? Many families are very worried about this.
Well, again, I think Dr. Arruda would want to comment on this, but what I've said is that we will give special attention, of course, we'll prioritize the CHSLD, the long-term facilities where there are an éclosion, more cases, and we need to do that. But the way the public health is doing it, maybe I'll let Dr. Arruda explain it in English.
In fact, it's related to the priorities that we need. We want and the quantity of tests. It doesn't mean that we will never test everybody elsewhere, but we also, if we had to choose, it's going through priorities, and it's the director of public health based on what is the situation in his region about cases with outbreaks or not, that will prioritize those testing.
Thank you. On our next question are from Raquel Fletcher, Global News. Tomorrow is supposed to be the peak, or are we still on track for that?
Yes, in fact, as I was telling, I think that we went through the peak. It's something different to understand, comparing that we got a lot of people dying. We're talking about the peak of cases. So even in Montreal, we are seeing something going in a slow down. It's slow. It's not. You know, we make the curve very flat, so it takes time to get up. I think it would take time to get down, but we are still the cases of disease, dying and at intensive care as related to what happens 15 days ago.
And as a second question, what concern do you have about the management of the West Island CIUS?
Well, I think the CIUS has done everything it could to provide the care at the CHSLD Héron, and the care also in other CHSLD, public CHSLD in the West Island. So again, what's important is to wait for the result of the investigations and the report of the inspector that I have sent to also review the situation at CHSLD Héron.
Thank you very much. That's all the time we have. Si je comprends bien, Monsieur le Premier ministre, on va se revoir lundi, c'est exact?
Exactement.
Parfait. Alors, bon week-end.
Bon week-end tout le monde. On va suivre la situation.